A specialized form of therapy is growing in the Midwest. Just this month in Des Moines, 60 psychologists and therapists were trained to provide what's known as eye movement desensitization and reprocessing. Studies show it's making a difference for patients struggling with PTSD and all types of trauma. Samantha Grunlin explains what can work when talking doesn't do the trick.
People do not understand how traumatic ordinary life events can be.
A lot of us have had trauma and we don't necessarily realize that it's trauma.
When people have their ability to cope overwhelmed, that the memory often feels like it's happening right now.
They can feel very threatened about, speaking up.
In many cases, patients are unable to overcome the trauma. It surfaces in the form of depression or leads to patients withdrawing from everyday activities, work, friends, and family.
Trauma itself stores in many parts of the brain that are nonverbal, that are much more feelings and sensory based, and it just helps tap into that.
In order to treat the depression, therapists must first get to the underlying trauma behind it, and EMDR is increasingly becoming the preferred method.
And we use eye movements through waving our fingers in front of the person's eyes to help them accelerate their processing of old material. So it comes to the forefront and it moves through the brain faster.
It appears simple, having patients focus on a therapist's fingers moving back and forth or a light bar making the same motion. Studies show the movement helps patients process past trauma, the first step toward coping and ultimately moving beyond the pain it caused.
So you want to bring that hyperarousal down so the person can still remember what happened to them, keep what's useful, but they don't have that high distress.
Clinician Bonnie Michelson is among the mental health professionals who believe EMDR can work for a variety of people, regardless of age.
With kids, we say we're going to visit the yucky memory and allow them to think about it in a way they didn't have a chance to when their ability to cope was being overwhelmed. And because of that, it reduces the symptoms that children come into therapy for.
Even proving to be effective in reducing physical symptoms.
So it's literally fainting, going almost comatose, or even seizure-like activity can get worked through, and that's very powerful because medicine isn't going to touch that.
Those who use the therapy say it's completely transformed their practice.
But it's the client outcomes. It's just been a game changer.
I don't see repeat clients for a reason, because when something's gone, it's really just truly gone for them, and they get to go live their lives, and that's a pleasure to be a part of.
Leaving people with a better outlook on the future.
A lot of times people will say, my job's gotten better, or this relationship has gotten better, or I'm able to speak up for myself when I wasn't able to before, or I'm able to set boundaries with people where I wasn't able to before.
EMDR is not a new therapy. Research began back in 1989. In Iowa, most insurance companies now consider it a medically necessary treatment for PTSD.